And it seems that diseases that were thought to have vanished are now returning. Such is the case in Australia. The country is facing its biggest diphtheria outbreak in decades, a disease many believed had been wiped out by vaccine drops. Authorities say more than 220 cases have already been reported in 2026, with infections now confirmed in northern, western and southern Australia. The outbreak began in remote communities in the Northern Territory, but genomic tracing has linked cases across borders, particularly into Western Australia's Kimberley region and parts of Queensland. Now, the Northern Territory has 133 cases, Western Australia 79 cases, South Australia is at 6, while Queensland has 5 cases. And that takes the national tally to roughly 223 infections, which is an unprecedented spike for a disease that normally records fewer than a dozen cases a year in Australia. There's an even more alarming fact. It is that authorities are now investigating what could be Australia's first diphtheria-related death in nearly a decade. The suspected fatality was reported in a remote Northern Territory community. Now, what exactly is diphtheria? It is a highly contagious bacterial infection caused by diphtheria, which it primarily attacks the throat and airways, but can also infect the skin. Before the vaccines become common, diphtheria was one of the leading causes of child deaths worldwide. In Australia alone, more than 4,000 people died between 1926 and 1935 from this. Doctors say that there are two major forms of the disease. The first is respiratory diphtheria, and the more dangerous form. Symptoms include fever, sore throat, fatigue and swollen glands. And within days, patients can develop a thick grey-white membrane in the throat that blocks breathing and swallowing. Severe cases can lead to suffocation, heart damage, nerve paralysis and even death. Even with treatment, up to 1 in 10 patients does face the reality of death. The second form of cutaneous diphtheria, which affects the skin, it causes infected sores and ulcers that heal slowly and spread bacteria through direct contact. Health officials say most of the current Australian cases are skin infections, but around 1/3 are respiratory, the deadlier variant. Now, medical experts say that several factors are driving this resurgence. One major concern is falling vaccination rates. After the COVID-19 pandemic, Australia's childhood immunization coverage has dropped below ideal herd immunity levels, and many adults have missed booster doses. The country's health minister, Mark Butler, has called the outbreak serious and possibly the worst Australia has seen in decades. Medical experts warn that immunity against diphtheria fades over time, which means booster shots are critical, not just childhood vaccinations. Doctors stress that vaccination remains the best defense.